Hi everyone. So for my multimodal project, I wanted to do something that hits home with me. So I wanted to do neonatal abstinence syndrome, which is also known just as NAS, specifically in the Cincinnati area. I wanted to focus on this particular topic in this particular, area because it's very prevalent in the Cincinnati area. And I work with children. I work at a daycare, and one of the children, he's about a year and a half or so. He was born with neonatal abstinence syndrome, and as I've been working with him, I've seen a lot of the problems that are associated with neonatal abstinence syndrome, such as language problems, cognitive, motor skills, and then also things with being irritable and fussy, feeding behaviors, and things like that. So I just wanted to go over what neonatal abstinence syndrome is. So neonatal abstinence syndrome develops after a baby is born and no longer gets certain drugs or medicine from the mother. So examples of this is methadone. Other examples are heroin and Percocet. And I added a diagram down here about how the baby receives the drugs in the placenta. And then after the baby is born, he suffers from withdrawal. And statistics in 2015 showed that 63 babies per 1,000 born were born with NAS, and this increased to 87 per 1,000 in 2016. So I just want to include some signs of neonatal abstinence syndrome. So if you are familiar with infants being exposed to drugs during the time they are in their mother's womb and they are born and they go through the withdrawal, you may be familiar with them tremoring, jittering, shaking. I remember when I took childhood development in high school, and this was the class, where you had to take a baby home to take care of it for a couple days. My teacher had a baby that, showed the signs of neonatal abstinence syndrome. And it showed all these signs. It would tremor, it would shake, it would cry, it was fussy. And other symptoms are poor weight gain, fast breathing, frantic sucking of fists, fingers, and thumbs. And also not the greatest of feeding habits. Infants with NAS experience early feeding difficulties and hyperphagia. Hyperphagia is basically just excessive hunger. So I see this with the boy at my daycare. He's, constantly crying and wanting to, snacks or lunch or other types of food. Like if I'm eating lunch, he will come up and be wanting my food because he's still hungry. And this can be due to early feeding behaviors because as a way to help calm their infant, caregivers typically try to feed their infant thinking it will calm them, that perhaps they are just hungry. And then this can lead to unnatural feeding behaviors later on in childhood that could later affect their weight. It's thought that NAS infants are at risk for later issues, such as cognitive, language, attention, and visual problems, which, again, I see in the boy at my daycare. He also has visual problems. He has a really bad lazy eye, and this is due to him being born addicted to drugs. So there's some treatment options for NAS. Cincinnati Children's conducted a 4-year study and discussed treatments of different patients, and this is using drugs as a way to treat the infants. So 72% were treated with methadone, 16% were treated with morphine, and 13% were treated with epinephrine. And this is typically done in the more extreme cases. Other ways to take care of a baby that's born with NAS is to hold the baby and keep the baby close when you're not holding the baby. So if the baby's, in a crib per se, you are still nearby in that room and the baby knows that you're there in that room, and that helps them to feel calm and secure. They can also be calmed by being handled gently and slowly. This helps with the tremoring and the jittering and the shaking. And if the baby is trembling and jittering, it's best to keep them warm and in a quiet room so they're not set off by certain noises or like the cold of a colder room. And if they're experiencing a fever, it's best to use light clothing. Excuse me. Effects of treatment. So infants treated with the drugs can show different developmental issues than those who aren't treated with the drugs and are just exposed to drugs during the pregnancy. So infants treated with methadone didn't show significant developmental issues on the Bayley scale of infant development. And the Bayley scale is a scale used for infants that are at risk for developmental issues. But there were small numbers found for morphine and epinephrine treatment for children. Cincinnati Children's found that infants needed pharmacological treatment after birth, and those that did receive that treatment performed more poorly than infants just exposed in the womb. And these treatments affected infants in that they scored lower on the Bayley scale in cognitive, language, and motor skills. So I wanted to talk about some action that Ohio has been implementing. So in 2014, there was a grant funded up in Cleveland for the Maternal Opiate Medical Support Moms Project, and this was to help reduce hospital stays, to promote improved overall health in both the infants and the mothers. And this improved the ability for the mothers to be put on epinephrine instead of methadone treatment, which decreased admissions in the NICU for the infant. The grant given to moms helped Metro Health to partner with opiate recovery as well as job training and literacy for workers who are working with these mothers and these infants. And also the Ohio Perinatal Quality Collaborative started a nationwide protocol in order to reduce pharmacological treatment to NAS infants. So they just started trying to implement different treatments and educate their workers on other ways to help these infants instead of using drugs as treatment options. In overall nationwide action, maternal screening has been implemented recently, and this is used to identify infants that are at risk for neonatal abstinence syndrome, and this can help to improve the outcomes as well as to decrease the length of hospitalization. So a way that they're doing it is using a test that takes the stool of an unborn fetus in the earlier stages of pregnancy, and this is the most recommended test to do as well as the easiest one to do because it's in the earlier stages, so they're able to get results more quickly than if they had to do a test that was later in pregnancy. The CDC partnered with the Association of State and Territorial Health Officials to launch a support system, and this was used to implement strategies to improve healthcare for mothers and infants across 12 states, and most of these states were more focused on increasing access to quality healthcare as well as providing training for their workers, and they were more focused on these aspects than the financial aspects and the data aspects. They were more concerned about providing quality healthcare for these individuals instead of how much it would cost them. In conclusion, 1 in 6 women who are pregnant smoke cigarettes in last stages of pregnancy. Although this isn't as extreme as drugs such as opioids and heroin and things like that, it still is a risk for the infant to develop issues such as cognitive, physical, motor skill problems. In Ohio, $3.5 billion are spent annually on unintentional fatal poisonings. So these are overdoses in hospitals. It is important to follow the advice of Cincinnati Children's, especially since that is our demographic. That's where we are located, but also other advice from medical workers who are experienced with neonatal abstinence syndrome in children. It's difficult to not only take care of a newborn baby, but to take care of one who is going through this withdrawal and having these symptoms. So here is a chart that I wanted to include in the end that just shows the increase in NAS syndrome and in pregnant women using drugs during their pregnancy. Every 15 minutes, a baby is born suffering from opioid withdrawal. And I think this is definitely a statistic that shows us just how important this topic is, not only in the Cincinnati area, but nationwide as well. Here are my sources, and I thank you all for listening. This topic is really important to me, and I hope in the future that this presentation helps you all to learn a little bit about it and to maybe take some action.